Many people associate HIV and AIDS with a death sentence still, or as something that is not included in their life because they're not in a certain group. In the early stages of the epidemic, that's very much what the messaging was, but that has changed. The epidemic has shifted, and HIV can affect and infect anyone. What we wanted to do was to help people understand that HIV is in the community and that we all have a responsibility to play in helping to reduce HIV and get Vancouver to zero. We want to be able to get to a place where there's 0 new infections in Vancouver. The numbers are actually going down. We have about 13,000 people in BC who are known to be living with HIV currently. We are the only province in Canada that is seeing a declining rate in HIV. The other provinces, unfortunately, have not had the same experience as British Columbia. Year on year, our rates have continued to fall, but we still have 300 to 400 new infections reported every year.
St. Paul's Hospital is internationally recognized for its research and treatment of HIV/AIDS, delivering 11% of all HIV/AIDS care in the country. It has an immunodeficiency clinic, a one-stop shop which provides primary care for about 1,100 patients living with HIV. It has a 24-bed inpatient ward where the sickest patients come to get treated. Nurse administrators Jane McCall and Agnes Stan say about 80% of the patients come from the downtown east side and Granville Street. Many have addiction and mental health issues and lead chaotic lives, and find it difficult to stick to the daily drug regimen required to manage the virus. St. Paul's is also home to the Centre for Excellence in HIV/AIDS Research Lab, where technicians test the blood work of all HIV-positive patients in Canada, with the exception of Quebec, to determine what drug combination the virus will best respond to. The gold standard in HIV treatment is a triple drug cocktail called highly active antiretroviral therapy, or HAART, which stops HIV from developing into full-blown AIDS and has turned the once lethal disease into a chronic condition. Dr. Julio Montaner, director of the Centre for Excellence and the chair in AIDS research at UBC's Faculty of Medicine, helped pioneer HAART.
Our expectation is that treatment and prevention is going to allow us to bring down HIV morbidity, mortality, and transmission to very low levels if we apply it correctly. But in order to really give it the final blow, we would like to have a cure so that we can get people treated appropriately, but then basically solve their problem without having them needing to take treatment for the rest of their life, which is a very taxing proposition. We view this as a success because we're coming from an era where there was no treatment and the outcome was universally fatal. So it is a huge breakthrough. But if we really want to make this better, we need something that would allow people to say, no more pills, no more nothing, it's done, it's over. And if we, in addition to that, could have a vaccine to help the HIV negative population to protect themselves, that would be fabulous. And so that would allow us to bring it down from virtual elimination of HIV, which is what we're currently proposing, to true eradication.